John Cush is coming back up, and a man who needs no introduction. And he's going to talk about adverse drug reactions in the newer therapies for RA.
So when we were planning this, David and I were talking, and we came up with this, although I must say in the 6 months preceding the talk, I wasn't really sure what I was going to talk about. So this, to me, is an opportunity for me to talk about things I don't get to talk about often, but that are in the realm of drug safety. So I do see a lot, I study a lot of things on drug safety. I'm going to cover some topics that often come up. They often are fringe topics. I supplemented the talk with some opening review of some of the newer drugs and what the package inserts are saying about these agents. These are my other disclosures. I'm the editor for Ruminology.com, a free online textbook that's out there for you to use. Artie Cavanaugh, myself, and Mike Steen from Vanderbilt have written that, and we'll update that for you. And there will be an app that will be free, and it's free on your mobile. There will be a book later on when we finish updating all the chapters. And RoomNow.com just launched this week, which is I'm the editor of, and that's a Monday through Friday daily news service that comes from me. And so I'm trying to put content out there that you might need on a regular basis to be a good and up-to-date rheumatologist. So Otezla is a new drug recently approved for both psoriasis, which was first approved for, and then just recently for psoriatic arthritis. It has both those indications. I'm fortunate to have done a lot of the clinical trials, as many of you may have done, in its drug development. It seems to be one of the major things about Otezla is it seems to be an incredibly safe drug. You know, there really isn't much in the way of monitoring. There really isn't much in the way of serious adverse events or death or really unusual things that happen with this particular drug. In fact, I would say that the warnings, precautions, and adverse events on here are pretty much a gigantic waste of time to even read about, because I don't think they're going to occur. I mean, this drug pretty much has one problem, and that is GI. That when you take this drug, 10 to 15% of patients will have diarrhea or abdominal pain, distress, cramping, bloating, blah, blah, blah. A small percentage of patients will not be able to tolerate the diarrhea, which is usually more than one. They have 2 or 3 bowel movements a day, and they tend to be not like explosive or watery, but just soft, and it just changes their bowel habits. They don't like that. So that's the major side effect that's actually not quickly apparent when you read this package insert. What is apparent is that the discussion about depression, I'm sorry, I don't see any of it. Didn't see any of it. The numbers are low, and it's a carryover from the population in which the studies are done. Psoriasis. High degrees of depression are seen in patients with psoriasis, much more so than that of RA. And given that there isn't much else to talk about, this is what we're left to talk about. But nonetheless, I guess if you have patients who are not stable and not doing well with regard to their psoriasis, this could be a risky choice. But honestly, I don't believe it is an issue. Weight loss is an issue. 10% of patients will lose 10% of their weight. This actually happens in animals. There's a loss of brown fat when you feed them a phosphodiesterase 4 inhibitor. The mechanism of this is not well understood, but I can tell you, I was doing work with Alan Mentor in psoriatic arthritis and psoriasis. So we were sharing patients in a few protocols, and then I did my own 50-patient RA protocol with monotherapy of Apremilast, and the first 10 patients, 2 or 3 were like, hey, I down 8 pounds, and this is a pretty good drug, and it's not from the GI distress, it's not from epigastric pain or gastritis and whatnot. They just actually do lose weight without becoming anorectic. So that's not necessarily an adverse event unless someone can't afford to lose the 8 pounds or 10%. And again, there is a cytochrome P450 interaction with the A3, it looks like, based on those drugs, rifampin, phenobarb, carbamazine, and phenytoin. So you need to keep that in mind. Again, the most common severe diarrhea was like 5%. The number that actually had to